Good afternoon. Thank you for coming. And thank you, colleagues. You've already heard from a couple, and you're going to hear from a couple more after me. I'm Representative Cynthia Ball. I'm the Deputy Leader of the House Democrats, and I represent House District 49 in Wake County, but I represent all of the North Carolinians in this state. For many North Carolina families, health care affordability becomes most urgent when a parent, a grandparent, a spouse, or a loved one begins to need long-term care. And I speak from experience, having been fortunate to be able to keep my parents both at home during their years with 24-hour care that they were able to pay for out of their long savings for many, many, many years. So we were fortunate to be able to afford it. Not many people could. That is why when families discover how fragile our system is, home care may not be available, facility care may be too expensive, family caregivers may be exhausted, and too often the system pushes people towards institutional care before every reasonable home and community-based option had been explored. The Aging with Dignity Act, which I'm proud to sponsor, is our proposed answer to that challenge. North Carolina's older population is growing rapidly. Our senior population is projected to exceed 2.4 million residents by 2030, significantly increasing demand for long-term services and support. But seniors often overwhelmingly prefer to remain in their homes and communities when possible. Yet that option is hampered by health care, workforce shortages, wait lists, geographic disparities, and administrative barriers. Our bill establishes a presumption in favor of home and community-based services for Medicaid-funded long-term services and supports. That means the default for care should reflect the needs and wishes of the senior and their family, unless institutional placement is medically necessary. It protects individual choice and makes it clear that the state should not unnecessarily push people into more restrictive and more expensive settings. The bill also addresses avoidable harm. It requires medication reviews for older adults receiving long-term services and supports, because when seniors receive conflicting prescriptions and different providers aren't communicating or aren't checking out different medications and how they interact, that increases the risk of falls, confusion, hospitalization, loss of independence, and ultimately higher costs for the senior and a degraded quality of life. Our bill would require regular review of medications to ensure that seniors are not being given redundant or conflicting medications that could have unintended consequences and a result in loss of capacity. It also integrates behavioral health and geriatric care, including dementia-capable services, because mental health, cognitive health, and physical health cannot be treated as separate silos. And it recognizes the reality of social isolation and loneliness. When an older adult is isolated, that can contribute to functional decline, worsening mental health, and preventable medical crises. Screening, referral, and care coordination for cognitive and mental health can help providers intervene before a problem becomes an emergency. This agenda also supports family caregivers, getting over a bad cold. Sorry. This agenda also supports family caregivers and the geriatric workforce. Family caregivers provide enormous unpaid care, but too often they are left without respite or financial support. Many of them are forced to take off from work or stop working altogether. my family didn't have to face that, as I mentioned earlier. While we went and spent a lot of time with our parents, we knew they were being taken care of, but it was not at the state's expense. It was at the expense of the money they had saved over their life. It's not sustainable for them and not sustainable for the state. That is why we include a pilot program that would pay family caregivers $400 a month to help alleviate their burden. Aging with dignity to us means living safely, living with respect, living with your loved ones, and having a real chance to remain connected to your home, your family, your community, and your church, and all those other things that you have enjoyed through your life. Thank you so much. I'm going to turn it over to Representative Weinstein, who's also going to talk about a bill.